Thanks. The completed ICQ, or internal control questionnaire, both Excel document and PDF with signature, and the proof of sufficient vehicle insurance if staff personal vehicles are used for transporting patients. The new applicants, it's the same grant application. However, there's an additional step, which is to submit a brief letter of interest submitted to Elizabeth via email by January 6th. Once we receive that letter of interest, we will follow up and send you the goals tables that I referenced in the last section. And you'll also, by the 20th, the rest of your application will be due, which is what we're covering today, the completed budget, the signed assurances, and then the 2020 goals table that will be sent to you upon receipt of your letter of interest. So that's an overview of the submission. Any questions that you may have, feel free to type those into the chat, and we'll try and address them. And in the meantime, I'm just going to go ahead and move into the next piece, which is just an overview of the actual grant narrative, part 1. So hopefully this isn't too messy. So we basically just talked about the guidance for the RFA, the first few pages, which are the intro, and then here's the cover page, which is the same as last year. You'll just need to fill this out. And the actual grant application starts really on this page, application for North Carolina Farm Worker Health Program funding. And it starts with section 1, farm worker needs and agency response. So please, one thing I want to bring your attention to is to note the word limits. You'll see them, I highlighted them in yellow for the first few questions. Please just make sure to stay within those limits as much as possible. We want to make sure that this is succinct enough for our grant reviewers, because they have a lot of grants to review. So we ask you to respect those word limits. For this first question, you'll see limit 75 words each. So for each of these boxes, you can write 75 words. And then other questions, like question number 3, limit 100 words for the whole response. So yeah, a lot of these questions should look familiar for renewal applicants. We've made a few changes, but I think they're pretty straightforward. And if, as you're working on it, you have questions, you can feel free to reach out to me or to your site consultant if you're not sure of the intent or are having trouble figuring out how to respond. So I think this section is pretty straightforward. I'm not going to spend too long on it. The next section is section 2, strategic collaborations and partners. This is similar to last year's as well. The emphasis here is on leveraging resources, expanding reach, and or addressing some of the social determinants of health. So instead of listing the specific agencies this year, we kind of grouped them by the issue or the content area. So you'll see legal worker groups or worker rights being the first, and then we give examples of potential collaborating organizations that you might work with. So that might be Legal Aid, Farm Worker Unit, could be North Carolina Justice Center. And so there are legal worker rights, chronic disease care management programs, which could be MCN, Migrant Clinicians Network, their HealthNet program, Project Access, or other local care management programs that you might have in your area. So you please, in each of these fields, you can type in what agencies from this that work within this realm that you collaborate with. And then in the third column, what we want you to detail is how this collaboration improves your reach or farm workers' overall well-being. If you had worked on a specific project or initiative with that agency in the past year, this would be a good place to detail that as well. And then at the bottom, you'll see that you have space to write 4 other collaborating agencies or partnering organizations So you would just write their name in the second column, and then just like the other ones, detail how this collaboration amplifies your effect or improves your efforts. So that is section 2, strategic partners, on page 3. And I'm just going to keep going, and I'll pause for questions at the end of this section, or the end of part 1, the grant narrative body. So section 3, access to health services. What we want you to do here is complete the following table for all of your agency's primary care access points. So for example, if you're a clinic, you'd want to write the location of the clinic, the minimum cost per visit, which would be like the nominal fee. We assume you all should have sliding fee scales, and so that would be what's the minimum amount per visit. And then you'd fill in the regular service hours, and then below that, any extended hours that are available to farm workers. So for example, Benson Area Medical Center obviously has a Thursday evening clinic, so you'd put the day, the time that is extended, and then the months of those extended hours. So you want to put any of your clinic sites that serve farm workers that are part of your agency. You would also want to include any mobile clinics in this section. Okay, moving on. And there should be enough room for you to put all of your clinics. I know some FQHCs have a lot of sites, so if you have more than 5, please just put the top 5 where farm workers access care. The next section is also part of access to health services. HRSA, these are the HRSA required services. Health Resources and Services Administration, our funder. So they want to see that, or we have to ensure that all of our grantees provide these services either directly or via referral. So you're going to want to list all agencies, both yours if you provide the service, and any others where you refer farm worker patients for each service. So for primary care, include both your agency and any others in your region where you refer farm worker patients, or where farm worker patients access care, primary care. And this would include both sites or organizations that are funded through NCFHP and those that are not funded, or not funded through NCFHP. Please include them all. Okay, and then the last section of this main grant narrative is the section 4 context, excuse me. So this is similar to last year. You'll want to put the key staff contact information in these fields. And then the next couple pages are for agencies requesting funds to support medical services only. So first is the Clinical Continuous Quality Improvement Committee, and you'll need to list the team members for your organization's CQI team for diabetes and hypertension. Please note that the lead contact, the first field, is responsible for scheduling quarterly meetings and ensuring that minutes are kept. So there should be at least 4 team members, and those should be identified here. And then the last page is, again, for agencies requesting funds to support medical services. And this page is where you list any healthcare providers and all other licensed healthcare workers who you anticipate will be working with farm workers this coming year. And this is how we initiate our credentialing and privileging process, which is required before NCFHP supported providers can see farm worker patients. So you'll list all of them on this page. And that takes us to the assurances, which should look familiar for renewal applicants. We reorganized them and tried to put them in categories that would make them a little more digestible. So you'll see program expectations, additional program expectations of agencies receiving funds for medical care, meeting requirements, So this would be the trainings and meetings that are required for those supported through the farmer administrators and outreach staff. And then lastly, documentation and reporting requirements. So hopefully that helps make those a little bit clearer. So that's part one, the bulk of the grant application, what all applicants will fill out. As you saw in the RFA guidance, just like last year, we will be using CQI and goals tables. And again, just like last year, that data is not ready yet for renewal applicants, but you should have received this attachment, which is just a sample. It's not for filling out. But these are where your previous data will be pre-populated here, and then you will fill out the goal sections and the last two columns. And we, again, have the access table, the quality enabling services table, special initiatives, and then quality clinical services. For new applicants, we will not have data from years past, so you will just be inserting goals depending on what funding you're requesting. So this will come out at the beginning of January, and we'll be discussing this at our operational planning retreat for renewal applicants for our current grantees. And as I said, you'll be receiving this form with your pre-populated data the week of January 6th. And we'll be discussing goal setting at OPR, and we also encourage you to work with your site consultant on these tables. So I think that is all for my sections. Before I pass it over to Elizabeth, are there any questions from attendees about these part one or part two, the CQI tables and goals? Or anyone on the conference line, if you want to unmute yourself and let me know if there's any questions on the conference line. Just give it one more minute to see if any questions come through in the chat. Just a reminder, you can type them in the chat box. And also we will have time at the end, hopefully, for some questions if there's any that come up or you think of while we continue on.
So one question came.
I think we have one question that came in. I'm going to read it aloud for everyone. So actually, Okay, can you all hear me again?
Yeah.
Great, great, great.
Yes, you're back.
Yay, I don't know why Skype did that, but it put the call on hold. So for those on the conference line, we're back. We're back. I feel like a broadcaster. I'm glad you can hear me again. Oh, it's about to do it again. I think everyone can still hear me. If not, my colleagues will come let me know. I'm going to pass it over to, oh, I don't think I finished the question. The question that came in, are there any changes to the internal control questionnaire form? Not that we know of. It should be the same, but we will let you know if we find out about any changes. So if there aren't any other questions, I'm going to pass it over to Elizabeth Freeman Lumbar, our program director, to talk about the budget. So here is Elizabeth.
Okay, hello everyone. Hopefully you can hear me. If you have trouble hearing me, please just write a note in the comment box. So like Ann said, this is Elizabeth Freeman Lumbar. It's great to have this opportunity to talk with you about our requests for application. I'm going to walk through the budget template, and what you're looking at is a partially filled sample budget. So I just want to start by reminding everybody that you must use this template that we provided you to complete your budget, and that overall there aren't any significant changes. Similar to last year, there are 4 different tabs: the Personnel tab, the Summary tab, which is the main budget, the Budget Justification tab, and the Budget Guidance that gives information specifically about funding limitations. And so once you have a chance to review the Budget Guidance as well as the Budget Justification, we suggest that you start your budget with the Summary on the Summary tab. When you fill in the name of your organization, it will auto-populate on the Personnel and Budget Justification tab. So you only need to enter the name of the agency once. So then you proceed with the project revenue section, and this here in column D is where you'll enter estimates that you have for any patient co-payments that you're going to collect. And this would be specifically associated with if we're paying for medical care with the grant funds at your agency, or that you're able to purchase on a fee-for-service basis. Please go ahead and estimate the co-payments that you would collect associated with those services. You can also enter any expected in-kind, whether that be time for in-kind supervision or other volunteers, any goods or materials, or here, other items. So I wrote in there in the space toiletries, for example, and the expected amount of that donation. And the totals in this area where you see zeros, those are going to, in the template, it starts as a 0, and the totals will auto-populate. So then moving down on, you'll see similar to last year, we divided up the proposed expenses into enabling, medical, behavioral health, additional patient services, administrative expenses, and other. One reason we're doing this is because we have separate funding for our behavioral health services, so this helps keep it clear as to what the request is specifically for behavioral health, but also sees how we're spreading out the invested funds. So similar to last year, when you are when you're on the summary page and you're ready to enter your salaried staff, so personnel who are receiving basically salary and benefits, you'll see again that this is the personnel tab is a worksheet to enter that information. And so here's an example. And so there's a section for enabling. Again, it's broken up: medical, behavioral health, and administrative staff. So most of that is pretty clear where you would enter, and this can be part-time, it can be full-time, but staff who are on salary is where you'd enter it. And then you'll see that it auto-populates in this area on the summary tab. The example I'm using here is it's sort of a unique example, but if you have a enabling staff person, so someone who is doing part of their job, in this case 50% of their time is devoted to enabling services, but the other 50% of their time is devoted to behavioral health services, you can break up the time of that same person, and you would reflect that by showing the portion of time, the portion of their FTE that is devoted to enabling services. And you'll see you type in what the overall annual salary is and what the portion is for this component. And you do the same thing for the fringe. And then fill it out in the same way here for behavioral health. Most staff people will be identified in one area or the other. Okay, and then coming back to the summary page, there is room for, so if you have staff that you are hiring on a temporary basis by hour, so in this case, enabling staff, it could be students and interns. This is the place where you would enter those individuals, the time for those individuals. And you'll see that the sample is here in this line 24, and I went in and filled in the sample of a temporary outreach worker. So it shows how many hours per year for the year that you're expecting that they'll work and what their hourly rate is. And so you enter the hours here and the total request here. And if there are other individuals, then you can enter other individuals there as well. The other associated cost with enabling staff comes down to staff travel, patient transportation, professional development, patient education, outreach materials. So for staff travel, this is if your staff are being reimbursed for their mileage. So you want to make sure to put in how many miles and what the rate is. And currently the limit, the state rate limit is at 58 cents a mile. And that can change in January, but we are not able to reimburse more than that. So you basically use what your agency policy is for the amount per mile, but not to exceed 58 cents. If you are reimbursing for patient transportation in any other way, through vouchers or use of buses or vans, then that is where you would put the total requested for that under patient transportation. And on the justification tab, you'd provide additional information about what that transportation service is being proposed. For professional development, there's an asterisk there, and that is because there's a funding limit for that per person funded under the grant. So for all your enabling staff that are supported, whether they're salaried with you, this is where you would put your professional development for them. The patient ed and outreach materials also has a funding limit, and that's based on the number of patients you saw for the renewal applicants, the number of patients you saw in 2019. For new applicants, that would be based on the number of patients you're proposing to see. And information about that is in the budget guidance. And so moving right along, you follow the same process with the medical services. I will say that not all grantees are requesting funds for medical services, so if there's anything that you're not requesting funds for, you can just leave that blank. Same goes for behavioral health. It's a very similar setup. Like I said, for any salaried personnel being covered is where you would enter that on the Personnel tab. And if you're not requesting it at all, you simply leave it blank. For additional patient services, this is where you would enter it. And what we want to see here is how many encounters you're proposing and what the cost per encounter is. It can be what the average cost per encounter is. If it's something that's going to vary by patient, give us an idea what that average will be. And again, you can provide additional information under the budget justification. Same goes for administrative expenses. And then overhead, well, I'll say with administrative expenses, there are some organizations that request funds for the time spent for the supervisor, for example. And so that's where that can be entered. Other organizations request up to 10% of the modified total direct care amount. And so basically, if that's requested, that is sort of covers your basic overhead expenses, including supervision and time by agency staff that are spending some of their time on the project. So just looking through to see, just a reminder about the limitations, the funding limitations generally for supplies, professional development, and cell phone. If you do request more than what the limit is based on the number of patients or number of FTEs, you must include justification for why you're requesting more than the limit. Similarly, if you are requesting funds for raises beyond 5%, there needs to be justification for that. And in terms of salaries that you all request in the grant application, we advise applicants to use your personnel policies and procedures for any salary increases or changes. And so just because if it's asked for in the grant and funded does not mean that is what changes the salary. The agency itself should be determining what the salary is and determining what the raise is and then asking for funds to support that. Let me see if there's some additional tips. Just want to make sure when you are reviewing your budget, this column A here where there's spaces for additional information, number of encounters, for example, or if you're asking for something specific that was not included there, just please provide that information there. Please make sure to use this year's template because although there are not significant changes, there have been changes made to it. We tried to improve upon the formatting of the budget justification, so hopefully that will be able to be printed out more clearly. And I think that is it. So if you have any questions about the information I presented, or if anything wasn't clear, if you could please submit that in the chat. And if you are on the conference line, if you can go ahead and pose your question. Just leaving a pause here to see if any questions come in. And as usual, as you're working on this, if questions do arise, feel free to contact us. Okay. no questions came in, so I am now going to pass back the microphone to Anne, and there will be time for overall questions about the presentation today too. So I'll pass it back to Anne, and again, it was good being on this call with you all.
Hi, everyone. Just a couple more tips that I forgot to mention earlier. We strongly encourage you to work together with your team. We see that applications are stronger when you involve the appropriate staff from your organization, for example, your finance folks, to make sure that your program operations and your budget are in alignment, your clinical folks to make sure that you respond appropriately to your clinical quality table and have good plans to address any areas that need improvement. So please make sure to work together with your colleagues. I should have mentioned this at the very beginning. As you may have noticed this year, the main part of the grant body is in Microsoft Word. It's a fillable form, not Adobe. It should be easy to fill out, but we would encourage you to copy and paste the narrative answers into a separate Word document should you, by the off chance, have any technical issues, and to save it frequently. Those were just a couple more reminders or tips. I'll go ahead and put up this last slide, which if you have questions after the call, or if you need additional information, if it's about the grant application, so either the content, you're not sure of what we're trying to ask, or if you have any technical difficulties, you can contact me, and there's my email address. If you have questions specific to behavioral health services that you want to propose or include in your grant application, please contact Allison Lipscomb, who is our behavioral health point person. And if you have any questions to do with credentialing and privileging or clinical CQI questions, please contact Dr. Gail Thomas. So I'm just going to pause here and see if we have any questions about any part of the grant application process. Or if you have any questions about life in general. Oh, we've got someone on the, I feel like a radio host. Yes. Is that Jesus?
This is Jesus. How are you?
Hi, Jesus. I'm sorry for the confusion. I'm glad you could join us for this part.
Yeah, I'm sorry about that. I thought I seen another email. I thought it said cancel. I'm like, okay, well, never mind. And so I started doing another thing. But I just got there. I'll say the latter part of what Elizabeth was talking about. I guess my question is, because I just looked over real quick. It don't seem like there's a lot of changes. There's some major specific changes, and I know you already talked about it, but I just wanted to know if there's something more specific than the previous year.
So for those, I don't know if those on the Skype online audio could hear that, but Jesus joined in through the conference line and was just asking if there were any changes. He said it sounds like most things are the same, or there are any specific changes. And there aren't really. Things are, there's some new wording and some new questions in the narrative, but there's really no changes in how we're asking for the budget information or the kind of guidance that we give about the budget. And just so everyone knows, I mentioned this at the beginning, but if you joined in late, or for Jesus to know that we are recording, and we'll be sending out the recording as well as notes from this call for those that couldn't join in.
Thank you.
Thanks. Any other questions? Now is your chance. We also have Dr. Thomas here with us if there's any questions for her by chance. All right, well, we're not getting any questions in the chat box and haven't gotten any more on the conference line. If you didn't type your name in the agency when you were signing in, please just make sure to write what agency you were from, your name and the agency. We want to make sure we document everyone that was on the call so that we can follow up with you. And as I said, we'll be sending out the audio recording as well as notes, and the information will also be available on the website. So I guess I just want to thank you all for joining us today. And if you have questions, if it's about these 3 specific areas you'll see on the slide, contact the appropriate person. You can always contact anyone on the team and use your site consultant as a main point of contact too. So I think that's it. Thank you all so much for joining us, and hope that you all have a great rest of your day. And for those of you that are current grantees, we look forward to seeing you in January at the Operational Planning Retreat. You should have gotten an invitation, or excuse me, the registration form a couple of days ago. We'll be in Winston-Salem again this year and look forward to seeing you there. And on that, I think we'll end the webinar. Thank you all so much.
Thank you.
Thanks.